So, next stop on our journey is the data quality team. And today we have Talia Perry is presenting. She's the team leader for the team. And she's going to be covering some ways about how we, I guess, go through processing and cleansing the data and checking it so that it moves along the next stage for use. And those are things like data preparation and validation, cleaning it all up, and a number of data quality investigations that they will undertake when they do, I guess, notice anything unusual in the data. Over to you, Talia.
Thanks, Kath. Hi, everyone. For those that don't know me, my name is Talia Perry, and I am currently Acting Manager of Quality and Assurance, but I'm also substantively the team leader for data quality. Okay, so the data quality team consists of about 6 members with all various backgrounds. We have previous hospital staff, such as myself and a couple of inpatient, outpatient clerical staff members. And we also have some long-term Department of Health employees like health analysts and those that previously worked within the data collections. So data quality can be seen as a very broad term, and there's many aspects that are undertaken by the health services, but I'm going to spend the next 10 minutes or so talking about what our remit is at the Department of Health. So our remit includes the data collections within ISPD, which are mainly utilised for national reporting. So our aim is to ensure that data within our collections is of the highest accuracy. To do this, we utilise 2 methods. So a lot of you will know about the formal data validation process, but we also do data quality investigations as well. Both of these allow us to work towards our aim and ensure that the Department of Health data can be treated as the foundation for both information and decision quality. So formal validation process. We are most known for our formal validation processes on the hospital morbidity, which has been undertaken for the last 20 years or so, the midwives notification system, and also mental health. Hospital morbidity and the midwives notification system work quite similar with validations, or also known as edits. That are some examples can be seen here, and they're communicated and rectified at site and then come back to us. Here's also an example of some midwives notification edits as well. Mental health also uses validations, but the communication is through a Power BI portal. And this has a write back functionality, so it does allow you to type straight into the dashboard that can come back to us in data quality. These 3 collections only allow data to be present in the collection once it's passed the formal validation process. So I'm just going to talk about the formal validation process and the key steps. So the data is delivered. So for majority of collections where WebPAS or Solus or a health application is utilised, it happens automatically through HSS. However, for private establishments, for example, the hospital morbidity collections, where there's about 80 plus private establishments, the data is actually provided to the data quality team, and we load this into the collection daily. I'll also talk about data preparation, validation, cleansing, and reporting. So for our 3 collections, there is for hospital morbidity, midwives, and mental health, there is a process to prepare the data before loading, as I mentioned, specifically for private establishments. Data validation. So the most common question that we get asked is how are data validations developed? For areas such as M&S and HMDS, the validation process has been active for many years. Most recently, the data quality team has identified certain metrics to ensure validations are only implemented when required, and these are based on the patient activity data policy. So there is a data specifications document, and it does say what is required, so whether the field is mandatory, whether it's in the correct format. We also have validation based on the business rules and the data dictionary. As Bernard and Catherine mentioned, the Independent Hospital Pricing Authority and Australian Institute of Health and Welfare, we submit our data to them as well, and they have specific validations. There's also been the implementation of new care classifications, such as the mental health and also upcoming the emergency care. And we also ensure that the data can be used for health service performance reporting key performance indicators. Data cleansing. So as the screenshots showed before, we've got a different way depending on the collection on communicating what data needs to be corrected. We've also developed data validation manuals, which are provided in the information compendium, and you can also contact us to receive it directly. So just a heads up, future collections. So the data quality team has been working with stakeholders on developing an emergency department data quality dashboard. We're hoping to release this in the coming months as a pilot. Specifically, these validations are based on data specifications, such as mandatory fields that are missing, and it is resulting in them failing the Commonwealth data submission. There's also some validations and improvement opportunities in preparation for the new care classification. So if your site would like to be included in the pilot of this, please let us know. The second part is data investigation. So not a lot of people are aware just the amount of data quality investigations the data quality team does each year. So these can be referred internally through the National ABF team, through the clinical coding as a result to an audit, and also through the analytics performance reporting team. We also get referrals through health services, private establishments, the Office of the Auditor General, and the Mental Health Commission. The outcomes of these investigations may result in education, suggesting application changes. For example, WebPAS may be referred to Hyatt if it can be monitored with an outcome recommended at a later stage. However, where possible, the data quality team tries to limit the amount of validations implemented each year. And as mentioned before, we do have a process in determining the requirement of a validation. So just to show you an example of some of the investigations that we've been involved in, we've reviewed uncoded cases for the HSPR indicator. In many situations, this has resulted in the identification of the data starvation, which is missing extracts between WebPAS and the Department of Health. We also conducted a review into the 7-day follow-up, contact for mental health, utilising Solace, which resulted in an education to Solace users with the support of HSS. We also constantly provide advice for long over-boundary outpatient appointments. So I'll now pass over to Kath for any questions.
Thank you, Talia. Well, that was really interesting to see the processing of data that goes on to check for that, that integrity and quality. And I can see like some very simple cross checks and some, we require a lot more complex queries and investigations. It's good to know that people can let us know about their data quality concerns. Now, I have a couple of questions for you. Someone has asked us already, in relation to like WebPAS, why do we have these edits for multiple weeks and also these ones that they drop off and then come back? It's pretty annoying, apparently.
Yes. So I certainly understand the frustration. For Midwives Notification System and for hospital morbidity, we actually do have a validation application. So the data feeds directly into this application, and you might have a edit, for example, a rare diagnosis. You confirm it to us by replying on your edit spreadsheet, and we lift that edit. However, if that event needs to be re-triggered at any stage, so for example, something changes during the episode and you retrospectively go back and update a data element, the event actually comes through like a brand new event. So unfortunately, it does mean that you need to reconfirm that previous edit. It's just how the validation program works. Yeah.
Well, I think that's important to know because like if someone goes back and updates something, it does come to us. So that's really good. Unfortunately, it might re-trigger if that particular record had some sort of edit on it. Okay, there is another question we have. For mental health, why is that dashboard so slow? So it's a good question and a complaint of sorts.
So the Power BI dashboard for mental health, it does hold a lot of information. If you are experiencing that it is slow at times or you're having difficulty entering comments, we do have issues with bulk comments, please contact us and we can help you utilise the dashboard differently to stop it from freezing so often. And if required, we can also send the response to another team who can look into it for you as well. But it is a lot of information on that dashboard. We are also working to review the dashboard. So we did have some stakeholders involved halfway through last year, and we are looking at adapt the presentation of the data in the dashboard. And we're hoping it will fix some of those errors with it freezing.
And another question, I think this is around, like, obviously out in the health services, people have their own data quality and checking stuff, which is great, guys, wonderful. And they would find some issues too. And someone has asked, is the East Metropolitan Health Service DDI, and I forget what that means, but is that the same? Like, are they doing the same kind of work as you guys, or?
Sure.
Yeah.
So as discussed with our remit, we actually look at the data collections. And in some cases, for example, emergency department, it's the data that's already within the collection. So if you compare your source system to what ends up in the collection, it's actually quite different. There's a lot of formatting changes. There's a lot of transformation between the raw data to the data collection specifications. So if you do pick up something and you're utilising an internal dashboard for your own BI units and you do find something and you think it might be worth us exploring, please send it along. We're happy to look at it. But no, it's not always the same data. So what you're seeing on an internal dashboard may have not been transformed to suit the collection data specifications. But it does eventually get there. So if you are picking up something which is incorrect or doesn't look right, it could have an impact on our collection as well. And we're more than happy to take the information and see what we can do to help.
Well, it's good to share that intelligence because I guess if something might be happening here, it's good to let us know so we can have a look at where it's an issue across other hospitals and health services. That's really valuable.
Okay, so I think we have 2 minutes before the next presenter, and I think we just wanted to address, we've received a few offline questions and a couple online just about how feedback was considered for the PAD in general. So just on that, all feedback received during consultation is considered by the ISPD team, and the outcomes of all the feedback are formally reported back to the system, and this is in a consolidated consultation report for the year. So the teams consider the whole state and implications for a range of systems. These are sometimes broader than WebPAS, so a small piece of feedback can have considerable implications. So we just wanted to address that and hope that answers a few of the questions we've received online today, and again, quite a few that we've received offline by email. So thank you for that.
Thank you. And thank you very much, Talia.